Hello, everybody. Welcome to Early Retirement Healthcare Coverage 101 for pre-65 retirees. We've got people that are filing in. We've got a great group this afternoon or morning, depending on where you are at. And so we'll dive into things here in just a moment. And I'm really looking forward to it. And so we'll get started here in just a second once we've got everybody in, which looks like we do. So I'm going to share my screen here, and you guys will get to know me, Cole, co-founder and head of growth here at Move Health, but you're also going to get to know health insurance options in early retirement. A couple of housekeeping things before I pull up my screen that I think are important for us to cover off on. Number one, yes, we are recording this session. Number two, yes, you will get the recording. So don't fear that you need to hold off on, you don't need to take pictures of the screen or anything like that. We'll make certain that you get the slides and things along those lines. So if you are here for, the underwater welding session, that actually happens next hour. So you might be here a little bit early. I'm kidding. We don't have an underwater welding session. But if we did, I would be in a wetsuit. So all that to be said, we're going to pull up our screen. We're going to talk about early retirement health insurance, and I promise we're going to try to make it fun. One of the things that I love is the chat functionality within Zoom. So if you know how to use that down there at the bottom, feel free to let us know. I love knowing where everybody's tuning in from. It's a lot of fun for me. And so I'm going to pull up my screen here, and then we are going to be off to the races. But I'd love if you use that chat function to let us know where you're at in the world. It's a lot of fun for me to find out. I'm in Indiana. That's home for me. And there's Minnie says California. Great, awesome. Wisconsin. Okay, very good, Jason. Charlotte, Michigan. This is great. Feel free, continue to use that chat for questions, comments, thoughts, things along those lines. If I've got something on my face, let me know. But no, really use that chat. Love knowing where you all are from. David from Indiana, but in Centennial, Colorado. Awesome. Enjoy the bluebird weather out there. Prescott, Arizona, very cool. And so we're going to cover off today on what healthcare coverage in early retirement looks like. And so you'll also see that Josie Living Good from our team, she's our director of marketing and community here at Move Health. She's in that chat as well. And so she might take some questions and answer them or offer up some deliverables or things like that you can look at over time. And so stay in tune with that chat function while we're kind of walking through the slide deck here. So early retirement, you're in the right spot. A little bit about us. You likely heard about us through your financial advisor, or you are someone who is an early retiree yourself. And so, looking forward to covering off on everything, but a little bit about us. Lots and lots of experience in the health insurance and Medicare space. And you can see, and I credit this to Josie, she's awesome, getting us recognized by lots of different places and articles. And, so we do a lot of writing for the Journal of Financial Planning and Rethinking 65 and Advisor Perspectives and wealthmanagement.com. So you'll see us as a thought leader in this space. And we think it's a really important component to what we do. We can help again with pre-65 health insurance. We're going to talk about all of those options, Medicare, dental, vision, all of those things. We're a Wealthy award-winning platform. What does that mean? Well, within the wealth management space, there's actually a wealthmanagement.com industry award, and it's called the Wealthy. And so we have won that. We also are a T3 tech tools for today, software all-star. And so we have a software for financial advisors they utilize to connect clients to Move Health and to use it to improve financial plans. And so as we think about early retirement, we think about financial planning, this is a big component. I don't have to tell this group, but as you think about retirement, typically there's 3 to 5 main concerns. And concern number one is usually, do I have enough money, right? And the second concern is how am I going to make that money last? And then the third concern usually is a follow-up to those two is what's healthcare going to do to it? And so the goal of today's conversation is not necessarily to get you answers to your very specific nuanced questions. Feel free to fire them into the chat if you'd like, if you're comfortable doing so. Rather, to give you an overview and landscape of where things are at as a whole today. And so looking forward to diving into that. So as we move forward here, I think it's also important to understand who you're talking to, right? Personalize myself a little bit. And so before I'm ever a co-founder and a head of growth at Move Health or anything along those lines, I'm a husband and I'm a dad. Those are my very two favorite jobs that I have. I like those more than Move Health, believe it or not. But husband and dad, so that's my incredible wife, Megan, and my two boys, Conrad and Porter, and they are so much fun that we've got another one on the way. And so this fall, we'll have our third and final, I promise, kiddo, and we're thrilled. So it'll be a surprise. We don't know what we're having yet, but we're excited about that. And I've got a personal story about why I wanted to launch Move Health, and it's specific to the early retiree space. So if you think about early retirement, you think about there's reasons why you do it. Maybe it's I want to travel. Maybe it's I want to fill time with hobbies, whatever you dream of in retirement. Would love to hear kind of what you want to do in retirement. But whatever you plan to do in retirement, sometimes it's spend more time with your family and grandkids specifically. And so if you look at this little guy with the curly hair in the middle, he's the reason we launched Move Health, believe it or not. And the reason being is I watched my in-laws when we told them they were 59 years old, and I told them, hey, we told them, I should say, my wife and I told them, hey, you're going to have your first grandkid. This was a little over 5 years ago now. We told them, hey, you're going to have your first grandkid. And they said, great. You guys didn't know this, but we were treating our first grandkid as our retirement date. So we're retiring in September. And so then the conversation started. They sat down with their advisor, and the advisor said, hey, the kids are through college. The house is paid off. The glide path on your money looks good, but there was still one big question in the plan, and it was, what are we going to do for health coverage between now and Medicare at 65? And a lot of times, that is the reason that people continue to work to 65. And even if we think about the average age of retirement in the United States, it is around 65. Why? And why do planning softwares and all these things build it around that number? If you don't think healthcare planning is important, think again, because we build it around when we get health insurance, right? We get it at 65 via Medicare. And there's some nuance to that, obviously, as well. But there is this gap of saying, hey, we'd love to retire before 65 when we're in our go years and we've, got our health and our ability to move and all of these things, and we don't want to wait, and we've got the dollars to do it. We just have to figure out how to make health coverage work. And so we're going to talk about that today. Besides being a dad and a co-founder, I'm also a part-time handyman. Thankfully, our kitchen and dining room, this is a picture of it about this time last year. Thankfully, it doesn't look like that any longer, or else this beautiful woman might not be in my life anymore. So I'm an old house renovator and, have been I guess you could still say have been a professional musician in the past. I still play a little bit. And that's a picture from 4th of July this year on the beach. We don't have a beach in Indiana, but that was us in Florida. It's all good. A little bit about my story, how we got there. So key learning number one. Again, if there's questions as we go through this, use that chat or that Q&A functionality in there. But key learning number one, we're going to talk about pre-65 health insurance basics and options. So we're going to roll through what the options are. These are in no particular order necessarily, but they are going to, cover off on each option. Now, I will caveat this with, there are some options that may not be available in your specific state. There are state regulations that will say, hey, this is available here, this isn't. I'll be sure to key into those as we walk through this process. So pre-65 health insurance basics and options. Something you may not know, how do people buy healthcare in the United States? There's 50%. I purposely haven't hit the transition yet. I'd love if anybody, there's 50% here and there's 20% here. I'd love to know if you guys can understand how the 50% and how the 20% might get coverage in the United States right now. 50%, it might be how many of you get coverage right now. So that one there, and this one might be the one that's upcoming as well, or not, hopefully. But I'll click through it because I don't see a chat that's come through. Oh, there's one. Here we go. Employer, yes. Mark says 50% employer. Jason, employer. Minnie from work, yes, 100%. That is correct. Let's say 50%. You get group health insurance through through your employer. You could be an active employee, a spouse, or dependent, or sometimes even a former employee. But 50% of the United States, gets coverage through a job, or a spouse's job or a parent's job. And so that's how most people in the United States access health insurance. There's 20% that get it through Medicaid. And that Medicaid portion is, you can remember the difference between Medicare and Medicaid. Medicaid, we provide aid to those that are low income. Medicare, we care for those that are over the age of 65. And so Medicaid, it's a state program for low-income individuals and children of lower income families that are 255% of the federal poverty level or lower. And so there's adult Medicaid in many states. Some states do not have adult Medicaid unless you're disabled, but many have it. And then there's this program called CHIP, the Children's Health Insurance Plan, and that's for children of low income families. And so options there with Medicaid. Many times, the clients that we are working with, we don't handle Medicaid, but they're not usually in the window because there's assets and things along those lines. So as we think in early retiree terms, there's probably not going to be a lot of folks that retire early and then take Medicaid. But happy to field any questions there. And so there are lots of other options there as well. So 50% through an employer, 20% through Medicaid, 15% through Medicare. So Medicare is for those that are 65 and older or someone who has become disabled. At Move Health, we can help with Medicare supplements, drug plans, Advantage plans as well. And so Medicare is a federal program, and I see a typo there. We'll fix it, I promise. But drug plans, Medicare Advantage plans, supplements, Medicare is a federal program. And this 15% is slated to grow fast over the next 10 years. The average, the average number of people turning 65 and transitioning to Medicare in any given day is around 12,000 people per day in the United States. So this number will go upwards as the U.S. ages. There's 40 million Americans between the ages of 55 and 64 in the United States. So 15% and growing is Medicare, and that's federally funded program. That's Parts A, B, etc. I won't spend a whole bunch of time there. 8%. This is what I call the young and invincible. No coverage. What? Oh my goodness. Don't be these people. Don't go without coverage. Self-insuring for health insurance is a silly thing to do because it's real expensive if something goes wrong. So as we look back here, we go, okay, 50% get it through an employer, 20% through Medicaid, that's 70%. 15% get it through Medicare. 8% don't have health insurance. So that leaves us with a 7% window. Well, what about the individual market? So as we look at this, there are 7% of people. Seems small when you think about percentage wise. It's over 25 million Americans buy their own health coverage outside of a job, outside of Medicare, outside of Medicaid. And so they buy their own. And so this could be, I saw some folks that were tossing some things into the, to the chat that get coverage through, it could be, David, it could be Obamacare, the ACA, we'll talk about that. It could be shared medical, a healthcare sharing program. Minerva, that's a great question there. And so I saw some options that kind of rolled through there. There are people that get coverage that way. So they buy their own healthcare plan. And, these could be people that are self-employed, work at small companies. These could be students, gig workers, or early retirees. And so these are all really good, things there. Juan says ACA. Good question or good statement there, Juan. Yes, you can, that's a good option for early retirees as well. We'll talk about the reasons why. So that's the individual market. Over 25 million Americans are in this window. So we're going to talk about some of the options that are available to early retirees specifically. So we're going to say first and foremost is COBRA. COBRA is not a snake in this case. It is, but it's not a snake in this case. It is the Consolidated Omnibus Budget Reconciliation Act of 1985. I should make that part of our trivia. If anybody can tell me what COBRA is, I'll send you a $50 Applebee's gift card or something like that. But COBRA, not a snake in this case, and it's not an insurance carrier. What it is it is a continuation of your exact same employer plan that you were on. So benefits, pros of COBRA, your deductibles carry forward if you're mid-year. So if you had a big healthcare year in the first half of the year, you're retiring, say, at Labor Day, and maybe you've already hit a deductible or a maximum out of pocket on that plan. If you take COBRA for the remainder of the year, or you elect it, your deductibles carry forward. And so that can be a value add for people that have already, maybe you're quote unquote playing with house money. You've met your deductible and maximum out of pocket, and their deductibles carry forward. There's no change from your employer coverage. So when you elect COBRA, and the way that COBRA works is that you pick it up. You can pick it up if your employer has more than 20 full-time benefits eligible employees. You can take COBRA, and when you do that, you can receive COBRA, and it is your exact same employer plan. We're going to talk about some of the cons of that. But the pros are deductibles carry forward. There's no change, so you're familiar with the plan. You're treated as an employee on the plan still for all intents and purposes. Now, the cons of COBRA. It is often the most expensive option. And the reason being is though you're treated as an employee and you're on the employer coverage, the employer, since you don't work there anymore, they're not paying for it on your behalf anymore. And this is what I say is COBRA is a really expensive way to miss your old employer. And that's a joke, obviously. But, and the reason that I say that is because you are paying the employee portion, right? That 100 or 200 or $300 a month that you were paying for that coverage while you were employed, plus what the employer was paying for you, which maybe was $1,500, $1,700, $2,000 a month that they were paying on your behalf. You're now paying all of that. And to add insult to injury, you are also, paying 102%. There's a 2% administrative fee because COBRA operates through an administrator that the group benefits administrator sends that out to. So you pay the administrator 2%. So you pay 102% of the cost of the plan. Another con of COBRA is it's not a long-term fit. So if you were like my in-laws at 59 and retiring and they took COBRA right from the jump, sure, they could do that. But guess what? We're kind of kicking the can down the road because in 18 months, we're going to have to figure out what our long-term solution is from, 61 in their case to 65. And so that's one of the cons that typically only lasts 18 months. There are times and in some states where you can elongate it or different scenarios where you can elongate it to up to 36 months, but generally COBRA is only 18 months. So last but not least, it's not creditable coverage for Medicare. And so if you get nothing else out of this, if you're someone who's becoming Medicare eligible and you're thinking about COBRA, they are oil and water. Do not take COBRA if you are otherwise Medicare eligible. And COBRA is not used a ton, mostly because of it being the most expensive option. Sometimes it's a good bridge to the next year where you can get on a different plan. You can leave COBRA early. You can't pick it back up if you leave it. But it doesn't last very long, and it's usually the most expensive option. And so feel free, if there's questions or thoughts on COBRA, fire those into the chat if you'd like. Moving forward, here's another option that's used by less than 1 million Americans at this point, but short-term major medical. And this is one of those that I said I would put an asterisk next to if it may not be available in every state or may have varying rules and regulations. That can be the case for short-term major medical. So if I've got people, I know we had some that were tuning in from California and maybe had a couple that were tuning in from I saw, Colorado, Georgia. There are some states where you can't really get a short-term major medical plan. California's a big one. But as you kind of think about it, there are some areas where you can't. Feel free to review that with us. But here are some pros and cons of ones that, of short-term major medical. They're usually going to have large networks, and these are a good option for healthy individuals with a short-term need for coverage. They usually have large networks, so it's going to be more easy to find a PPO network, if you will. They're often going to be lower cost than an unsubsidized and a non-discount ACA plan. We'll talk about the ACA in further detail here shortly. Often lower cost than a fully unsubsidized ACA plan. And there's no special enrollment period needed in most cases for a short-term major medical plan. You can start them as soon as midnight the next day, right? Now, some of the cons. Most short-term major medical plans are not ACA compliant. Why? Because they're not going to cover what I call the 3 Ps: pre-existing conditions, pregnancy, or prescriptions, right? And so if you are someone that has ongoing chronic health conditions or medical needs or medications, or you are family planning, our early retirees likely aren't family planning at this point, but are good to know. It's not going to cover those, and those are very clear exclusions. That are made known as you enroll into the plan. But what they are there for is for catastrophic coverage, if you will. And another con is that because of their non-ACA compliance, most are medically underwritten, right? So these are going to be able to ask, if you remember, we'll talk about the Affordable Care Act here in just a moment, but the Affordable Care Act said, hey, if you're going to get coverage through the marketplace, they're not going to be able to ask you any health questions. Short-term major medical acts a lot like health insurance before the Affordable Care Act. And so they might ask questions, about your height, your weight, your medical history, your prescription history, all of those things. And so those are certainly things to be considerate of. But if you are healthy, high income, and live in a state where these are available, it's an option to certainly review and think about more closely. Juan had a chat in there that said Cobra, if we go back one, Cobra worked out well as a transition tool. Being single, my cost was not that bad. I assume family rates would have been way higher. Yeah, that can be the case, right? So it all depends on how many people you have on the plan. Is it employee? Is it employee plus spouse? Is it employee plus family? Employee plus family being the highest expense, employee plus spouse second most expensive. So Cobra can work, and it's always good to understand when you are having those retirement conversations, what is it going to cost us, just so that we have all options on the table. Short-term major medical, as I mentioned, pros, large networks, no special enrollment period needed, and if you're going to be fully unsubsidized on the marketplace, the ACA marketplace, it might be a good option if you're healthy and high income. Cons are that it's not ACA compliant, doesn't cover those 3 Ps, and it's going to have some medical underwriting associated. And again, as I mentioned, state regulations might limit the length you can have them or if you can have them at all. Another option to review is on the rise in popularity because of a couple of reasons, which I'll share with you in a little while, is healthcare sharing programs. These are a non-insurance alternative for individuals and families, and they are unique, and we don't recommend them certainly for everybody. There are pros and cons to each of these options that we are discussing today. This is a non-insurance alternative, and so this is something that is a healthcare sharing program. What are some of the best parts of it or pros of them? They're often up to half the cost of an unsubsidized marketplace plan, right? We're going to talk about what unsubsidized marketplace plans might look like, but often up to half the cost, right? They usually have large networks or sometimes no networks, and it's going to be something where you work on a reimbursement basis, but it's a large or no network, right? And there's no special enrollment period, so you can join these at any time throughout the year. Now, similar to short-term medical, they may or may not be ACA compliant. So they might not share in, and you notice I'm not saying cover, I'm saying share. They might not share in, pre-existing conditions, or there might be a waiting period, or there might be limits on how much they'll share for those. They might not share in prescriptions, or they might have limits on it. And they might not share in other things. They might not share in maternity if that's important. But another con may be that there's no coverage guarantees since it's not technically insurance, right? Typically, these are pools of members that are saying we're going to share in each other's medical expenses. Usually, there's a grouping of guidelines that you abide by. Sometimes there's a faith-based component to them. There are some that are large that are out there like Medishare or Zion. There are others that are not faith-based that are things like Crowd Health, things along those lines. And so these are on the rise for a variety of reasons, but one of them being is that health insurance is not getting any less expensive, and so people are looking for alternatives. Things to look out for: smaller healthcare sharing programs that are not proven or are not large or have stability and a board of directors and all of those things. If it looks too good to be true, it might be, but smaller healthcare sharing programs may fizzle out. And I even use an insurance term here, or be insolvent, meaning that their medical needs that are occurring within the member pool might be more than what they've actually got on hand. And they might, since there's no guarantees, they might just say, hey, sorry, you're up a creek there. So it is an option, certainly, to review. It's one that's growing in popularity, but not a fit for everyone for a variety of reasons. We will recommend it in unique use cases here at Move Health if it's deemed to be the right fit. And we'll always check in with those folks if that's the case. Now, Affordable Care Act plans. 92% of the individual market is utilizing the Affordable Care Act. And so this could be known as marketplace plans, ACA plans, Obamacare. These are going to be, options that are, we're going to go through the pros and cons of each of those. But if you're in California, this is covered California. If you are in, Indiana, like where I'm at, it's healthcare.gov. It's a federally facilitated marketplace. If you're in Pennsylvania, it's Penny. If you're in Colorado, it's Get Covered Colorado. If you're in Illinois, it's Get Covered Illinois. Illinois was took that from them, I think. If you are in Washington, it's Washington Health Plan Finder. If you're in New York, it's the New York State of Health. I'll stop naming them, I promise. But each state might have its own marketplace. There are about 30 states that operate on the federal marketplace, which is called healthcare.gov. This was rolled out under the Obama administration. The Affordable Care Act was written into law in 2010. If you remember, the Obama administration ran on healthcare reform, and they said we're going to create, a situation where people can get health coverage if they are outside of a job. Because if you remember, if I go back to the short-term medical example, that's kind of how health insurance worked prior to the Affordable Care Act, where somebody might be working and they might say, hey, I'm 61, I'd love to retire, but I had a heart attack, a year and a half ago. And, we in the health insurance space would have had to say, hey, there is not an insurance plan that's going to accept you outside of your job. And so that became a really big sticking point where you'd have people that would either leave their jobs or get terminated. And their option was, I can take COBRA for 18 months, or I need to go find another job that's going to give me health insurance because I can't get an individual health insurance plan. The Affordable Care Act changed that. Written into law in 2010, the marketplace enacted in 2014. What are some of the pros of the Affordable Care Act plans? They are guaranteed to cover pre-existing conditions. There is no medical underwriting. They're not going to ask your height, your weight, your medication history, your health history. You could be undergoing current cancer treatment, transition to an Affordable Care Act plan, and you can, have coverage start immediately for that. So that's one of the pros. Covers pre-existing conditions. Early retirees, there are some of us that have made it there really in a healthy format. There are some of us that, no fault of our own, have some bumps and bruises along the way, and we might have those pre-existing conditions. And so the Affordable Care Act is an option for you. Rates are based on, as I mentioned, there's nothing about health history, height, weight, prescription history, things like that, age, location, and if you are a tobacco user. Those are what rates are based upon. If you qualify for subsidies on the marketplace, which we're going to do a deep dive here in just a moment, it's often the most affordable option. Last but not least, it allows managing of your modified adjusted gross income to help lower premiums to qualify for subsidies. And so this is where a lot of our work with financial planners and financial advisors, wealth managers comes in, is we're helping the advisor to understand the impact of modified adjusted gross income on subsidies and premiums. And I'm going to walk you through some real life examples here. What are some of the cons of an Affordable Care Act plan? Well, you can imagine that when the federal government came to insurance carriers, health insurance carriers that were in the individual market and said, hey, if you want to participate in the marketplace where we believe 92% of the market is going, you have to accept everyone, right? And so actuaries at these insurance companies were saying, how are we going to do this? Well, we have to put everybody into the most dangerous risk pool for us as a carrier. We have to assume everybody is undergoing current cancer treatment, has a laundry list of medications and all those things. So rates went up significantly overnight on Affordable Care Act plans. But the Obama administration knew that would happen, cause and effect, so they created these things called subsidies, which we'll talk about further. Some other things that carriers did to reduce their cost and de-risk a little bit, insurance all about transfer of risk, is they reduced network sizes, right? So they said, we're going to have, contracts with specific, hospital networks and providers and things along those lines that may limit your flexibility. So if you're on an EPO, an HMO, a POS network, those might provide emergency-only coverage outside of your network area. They will provide emergency coverage, though. They can, if you are receiving subsidies via the marketplace, they can require a little extra legwork during tax time. You get a form that's called a 1095-A, which then transitions into a tax form called a Form 8962, which says, hey, based upon the modified adjusted gross income that I had, was I correct in my assumption of what my income was going to be? Do I owe some of those subsidies back, or should I receive more of them in a refund? And just so you know, they can have higher out-of-pocket costs than employer plans. Those are things to be mindful of. As I mentioned, ACA plans, they're guaranteed issue. Because of the Affordable Care Act, all plans purchased through the marketplace are guaranteed issue. Can't be denied health insurance because of a pre-existing condition. As we talked about, rates are only impacted by your age, location, and tobacco usage status. Coverage on the marketplace is available through major insurance carriers, and so you might go to to the marketplace, and you might see familiar names like Anthem or United Healthcare or let's see who else, Oscar, or lots of other options, Med Mutual, Priority, etc. You'll see names that you recognize at the very least from your local carriers, but through major insurance carriers as well. So we talked about subsidies and advanced premium tax credits. Subsidies and APTC, or advanced premium tax credits, those are synonymous. So we're going to talk about key learning number 2, which is advanced premium tax credits. Well, what are they, right? Their purpose, and this was part of the Obama administration's Affordable Care Act law, is to make health insurance and premiums more affordable for individuals and families purchasing plans on the marketplace. I always like to reference, hey, purchasing plans on the marketplace. You can't apply these advanced premium tax credits to Medicare. You can't apply them to Medicaid. Can't apply them to COBRA. Only for plans purchased through the ACA marketplace. They're advanced because they're applied before taxes are filed. This is directly lowering your monthly premiums. So as an example, you might say, based upon my income, the federal government is going to give me a $1,000 a month advanced premium tax credit. The plan that I want to purchase through the marketplace is $1,500 unsubsidized. Now, if I get a $1,000 advanced premium tax credit, that's going to come off immediately from the cost of my plan, and I'm going to pay the net. So the gross premium is $1,500. I get a $1,000 advanced premium tax credit. Monthly, I will pay the insurance carrier directly $500. And that's why they call this the marketplace, because it's where the federal government and insurance carriers and covered individuals all sit together and they coordinate. And so there's $1,000 coming directly from the federal government to the carrier. There's $500 coming directly from the covered individual. And that's how the full premium is paid. They're advanced because they're applied before taxes are filed. And so that's what that advanced portion is that actually happens in real time. Why do advanced premium tax credits exist? Well, like I mentioned, before the ACA, many Americans couldn't afford private insurance or they just couldn't get it. So APTCs were designed to offset the cost of marketplace plans. You remember that actuary that I talked about who said, we're going to assume everybody's in the highest risk pool. So plans went up significantly in cost. It's also going to encourage more healthy individuals to enroll, balancing the insurance risk pool. So if we say, hey, we're going to offset the cost here a little bit, we're probably going to bring in those people that can qualify for an advanced premium tax credit, but maybe don't have pre-existing conditions and maybe don't need all of the provisions that the ACA provides, but they're going to pay less for their health insurance by going to the marketplace. So it encourages that, balancing the insurance risk pool. And it also was in an effort to reduce the number of uninsured Americans. Believe it or not, there's 8% that are uninsured in the United States right now. That number has steadily come down since the Affordable Care Act was put into place. It's funded through the federal tax system, and it is a refundable tax credit that is tied to your income. So refundable, there's non-refundable tax credits and there's refundable tax credits. Not refundable means if I said that my income was going to be $80,000 in modified adjusted gross income in 2026, because you make an estimate for the year, we'll talk a little more about that. Make an estimate. Moving forward, if I said, if I came to tax time and I actually made $70,000 that year, I would actually get a little bit of a tax credit or tax refund that would come to me that says, hey, these are federal dollars that you shouldn't have paid to your health insurance plan because you said you were going to make 80, but you actually made 70. And so we're going to refund a little bit of it. So it's a refundable tax credit. How do they work, right? How do I qualify for these? Well, you estimate your household's modified adjusted gross income for the coverage year. We help you to do this to understand how it works. This is also if you're someone who's working with an advisor, your modified adjusted gross income might not be the same number as what your take-home income is. A good example of this is, someone might say, I need $100,000 a year in to cover my costs and travel and all those things that I want to do in retirement. But a savvy financial planner might say, hey, we want to remain within certain thresholds. So we're going to take from a couple of different sources and we're going to make your modified adjusted gross income look lower than that. And that will help to qualify for subsidies and potentially maximize them. The marketplace is going to calculate your expected premium contribution based on a sliding scale, which we'll talk about here in a bit. And the federal government, as I mentioned, pays the difference between your expected contribution and the cost of a benchmark plan. Benchmark plan is a marketplace specific term that is the second lowest cost silver plan in your given zip code. And again, the credit's applied monthly to lower your premiums in real time, and you reconcile that credit when you file your federal tax return. Feel free to ask any questions on advanced premium tax credits. Hopefully, I can't see you all, but hopefully you all aren't glazing over and you're saying this is too much information. Who can get advanced premium tax credits? Well, you might qualify for an advanced premium tax credit if you are not eligible for coverage through an employer, Medicare, or Medicaid. That's important. If you have coverage available to you through an employer, a spouse's employer, you can't get a tax credit. If you have coverage through Medicare, you can again get a tax credit. Medicaid, you have to enroll through a marketplace plan. These are often referenced as on exchange or on marketplace options. And you must maintain an income between 100% and 400% of the FPL. FPL. Bonus points while I'm going through the rest of this slide if someone can tell me what FPL stands for. So you're maintaining income between 100% and 400% of the FPL. What is the FPL? Anybody know there? Here we go. Here's a question. Andrew, federal poverty limit. Yes, that is correct. 20 points. You can redeem those at the prize counter at the end of the session here. Your next question, what is it? It's the federal poverty level. So who can get it? We know that. And then let's look at the ACA tax credit timeline. And so, David, I see there, I see that this is being recorded. You'll have access to the replay. Absolutely. We'll make certain that you get it and can share it with your wife there. So let's take a look at the ACA tax credit timeline here. January 1st, 2014, as I mentioned, the ACA marketplace was born. Coverage is guaranteed issue. You can get it with pre-existing conditions. It's a big win. If you remember, Joe Biden was when the Affordable Care Act was passed in 2010, he leaned over. He was the vice president at that point. He leaned over and said, "This is a BFD." The first word being big, last word being deal. I'll give you what the F was. I won't say it live on air, but he said that, and it was a BFD, right? So Jan 1, 2014, the marketplace was born. March 11th of 2021, the ARP was passed. This is the American Rescue Plan Act. And subsidies became available to those that were over 400% of the FPL. And then the Inflation Reduction Act was passed, and that extended those enhanced subsidies through the end of 2025. So if you know and you're with us and someone's asked you recently, what year is it? It is 2026. So advanced, or subsidies available for those over 400% are no longer in play. If you remember late last year, the federal government shut down for a series of weeks, and they were arguing over these advanced or American Rescue Plan Act enhanced subsidies. That's actually what they were shut down over. Democratic Party said we need to continue them. Republican Party said no, and so they walked through that. And so at the end of the year, they never came to a resolution. The Rescue Plan Act subsidies expired, and it reintroduced the federal poverty income cliff. So the income cliff is something we need to be really mindful of as an early retiree that may be getting coverage through the Affordable Care Act marketplace. You can see there's an important D on this page, how tax credits worked from 2022 to 2025. Tax credits worked on a spectrum, with plan premiums being subsidized down to 8.5% of your modified adjusted gross income or less. So it was easy. If somebody asked me, Cole, I'm in the ice cream aisle they meet me in the grocery store. I'm in the ice cream aisle. I've got 2 boys at home. I like ice cream too. I spend a lot of time there. If you see me there, they ask me, hey, in 2025, my income is going to be $100,000 as a household of 2. What should I expect to spend on my health insurance premiums? And I'd say, well, if you go to the marketplace, you shouldn't expect to spend more than $8,500 a year because I'm $100,000 in income, 8.5% of that. And you can see it went down as your income went down. Your expected level of contribution did as well. And tax credits were available to those that were above 400% of the federal poverty level. So that's how it worked. And so, Chris, for an advanced premium tax credit, yes, if you are a single individual, because I'm going to go to this next page here. If you're a single individual, household of 1, you would only be eligible for a tax credit if your income was under $62,600 in modified adjusted gross income. Good question. You can still buy a plan through Covered California through the marketplace. It just wouldn't be subsidized if income was above that threshold. And so, Chris, good question. This is how advanced premium tax credits work and have worked prior to 2022. We talked about the American Rescue Plan Act, how it worked. This is how they work now. You have tax credits up to 400% of the federal poverty level, and it's unavailable for those that are over 400% of the FPL. So, as an example, let's say it's an early retiree couple. I'll use my in-laws as an example again. They would need to have a modified adjusted gross income of $84,600 or less in order to get a tax credit via the marketplace. Now, if they said, hey, I'm going to make $84,600, they'd get a tax credit. If they go $1 over and make $84,601 in modified adjusted gross income, they lose all of that tax credit. So it's important to be mindful. It's never been more important to be mindful of what your income is and how it plays into the advanced premium tax credits you may or may not receive. And so you make that estimate. So let's say we were enrolling in coverage for 2027. You do that during the open enrollment period, which we'll talk about here in a bit. You would then get those, get those tax credits throughout the year in that advanced format. And if your income ended up coming in higher, you could lose those tax credits. And this could be a $10,000, $12,000, $20,000 a year, mistake if you end up going over. So we always like to be as realistic as possible of what our income is actually going to be. And sometimes that's just biting the bullet and saying, we're not going to take tax credits. We know we're going to be over it. So that's how they work. Here's a real case study, right? 62-year-old, husband and wife in Nashville, Tennessee, income of $250,000 a year. They could expect to spend, $29,000 a year if you remain above 400% of the federal poverty level. That's what their income would total out to. Household of two, Nashville, Tennessee, $250,000 a year in modified adjusted gross income. And so that's what that would look like. There was one question that I always love getting, David, to confirm. The marketplace for advanced premium tax credits is looking at your current year's income. It's not looking at your assets. It's not looking at your previous year's income. It's looking at what your estimate is for the current year. So in your example, if you said, I'm retiring, early in the year, you would be someone who would say, I'm going to make an estimate for all of 2027, and make a guesstimate based on that. And so if a person's retiring early in the year and they have a decent amount of dividends and interest, it's looking at what you receive in that year. So in 2027, your total year, there is an example. If you're 64 today, there's lots of great questions pouring in. This is awesome. Juan, if you're 64 today and you'll be eligible for Medicare in June of 2027, is the cliff still 62.6 for a single person for the year in order to get the credit? Yes. It is an advanced premium tax credit, but it still is based upon your total year's income. That's a really, really good question, Juan. If you are someone who is only on the marketplace for a portion of the year, the tax credits you receive are still based upon your full year's income, because you're still going to file that 8962, and it's going to be based upon, hey, this is what I received in a tax credit throughout the year. If you were only covered by the plan for 5 months in your example, you would have 5 months of tax credits to reconcile, which if you got your income right, you'll hit the nail on the head. If you were a little low, you might have to pay some back. If you were a little high, you might get a return. Minnie says, if tax credits are not available for above 400% FPL, but the end of the year your income meets the 400% income level, do you get the credit back? Minnie, really good question. This is why it's important to apply for tax credits. If you think it's possible you will end up under 400%. So let's say I'm planning on, if I go back to my chart here and I say, I'm planning on making $95,000 as a couple, right? Let's say that just in this example. I'm going to be over 400%. We're going to say, we're going to make $95,000 and we're going to pay the full boat for the premiums, but we're still going to apply for a tax credit in the event, knowing we'll get a $0 tax credit, but in the event that our income goes beneath it, yes, you could get it, but you need to make certain that you apply for the tax credit, even if your income is expected to be over it. That way, if you go under that threshold, it can be that, take care of that. Venkat, sorry if I butchered the pronunciation of your name, but you asked, are these plans high deductible health plans? The answer is yes. There are high deductible health plans as options in this that are HSA compatible. There are also, plans that have copays, etc. And these there's examples of both of them. So great question. Let's go back to our real case study here. The 62-year-old couple in Nashville, Tennessee, $250,000 in income, $29,000 a year in premium is what they could expect to pay. Let's show the power of the advanced premium tax credit, right? So let's say that they have flexibility in where income is coming from. This is something you could work with an advisor on. If you're a DIY person, this could be taxable brokerage, this could be Roth dollars, etc. You could unlock for the next 2 years, 3 years in this case, almost $23,000 in a tax credit annually, just simply by keeping your income within 400% of the federal poverty level. So that takes that $2,400, $2,500 a month plan down to just $550. That's the power of the advanced premium tax credit. And so, the advisor could use those tools to do effective income management when buying healthcare coverage. Now, some of us don't have that flexibility. We're all pre-tax dollars, etc. Maybe it could make sense. I'm not the financial advisor, but that we've seen people in the past use Roth conversions and doing those early and actually using those Roth dollars to supplement income in order to keep income lower because it's not going to contribute to your MAGI. So great thoughts and questions that are happening in the chat there as well. Timelines and action items. We're landing the plane here, everybody. I promise. Hopefully this has been helpful for you all. Would love your thoughts and feedback in the chat there as well. When can you enroll in Pre-65 coverage? When we think about ACA plans and COBRA specifically, you must have a qualifying life event, a QLE, which creates an SEP. There's lots of different acronyms in health insurance and Medicare. So you can have a QLE that makes an SEP to enroll in the ACA, right? So I won't speak in those terms, but special enrollment period, you have to have a qualifying event. Retirement and losing coverage through a job, the untimely or unfortunate death of a spouse, divorce, aging off of a parent's policy if somebody is turning 26, to qualify for a special enrollment period outside of the annual enrollment period. So that's for ACA. You can enroll in healthcare sharing programs and short-term major medical in most cases at any time. It varies for retiree benefits. There are retiree benefits you could potentially take through a job. That's an option that we didn't really touch on, but if you worked at a large employer or a government entity, you may have retiree benefits available to you. Typically you have a 30 to 90 day window within retirement to take those. If that's something that you have, be sure that to bring that to a conversation with our team if you have retiree benefits available, because we can compare and contrast those against what your options are. One note for retiree benefits, don't assume they are the best option and don't assume that it's going to be the exact same plan that you had while you were actively employed. Those are important things to note there. Open enrollment. This is the time of year, every year in the fall, when you can enroll in ACA plans regardless of life events. And so those are great questions. This is typically on a federal level. Some states will have longer, some states will have shorter. Some states will, sometimes the federal government will extend this. But as a good reminder and rule of thumb, November 1st through December 15th is the open enrollment. And that's for the healthcare.gov ACA marketplace when you can make changes, enroll into for the first time. You could drop COBRA during that time of the year and pick up an ACA plan, et cetera, et cetera. November 1st through December 15th. Easy way to think about it so you don't get down to the wire. Take care of it before Thanksgiving. If you're on the ACA, take care of it before Thanksgiving, and that's how that will work. So easy one to remember. Minerva, great question, asks, how about coverage for dental and vision? Those are going to fall into similar windows where you can start a dental and vision plan at about any time, right? You could pick that up at any point. But another thing to note is sometimes now on the medical side, major medical side for COBRA, that can be really expensive. COBRA can be a fit. You can actually take COBRA for dental and vision. And sometimes that can be a good option if you love your dental plan that you have. You can sometimes keep that through COBRA, believe it or not, and just elect that and not elect major medical. That said, we can offer and certainly can help with, individual dental and vision as well. That is really, really comprehensive too. So, but you can enroll into those at any point. That's not a specific enrollment period for those. What should you review who should you review annually during open enrollment, right? Pre-65 retirees, small business owners, someone responsible for buying their own health coverage, it's a really good thought there. Make certain you're touching on that. People on Cobra who want to explore potentially ending it early. So maybe this is someone who met their deductible in 2026, but for 2027 will have some flexibility in income, and they'll be able to qualify for a tax credit and save some money on their premium. Let's do that. People who had recent changes in health, medication, location, income. This is why it's really important to review plans every year, because if you moved, your plan's not going to work for you in your current location or could be optimized. Maybe your health needs have changed. Maybe your income has changed and you want to review, and maybe you didn't qualify for a tax credit this year, but maybe will soon. People who want to evaluate HSA compatible plans, that's a time of year to do it. And if you're just looking to optimize, right, this is a good time of year to say, am I in the right place? And if you're on an Affordable Care Act marketplace plan, that plan is going to renew on January 1st. Deductibles will reset, etc. It is technically a different health insurance plan every year. You must renew it. You can passively renew, but in the case we always of renewal for ACA specifically, we always recommend doing what's called an active renewal, which is being involved in the process and not just letting it roll over, because you want to update your income or update the plan if necessary. Great questions there. People who want to access an advanced premium tax credit or are already, make certain that you review your coverage every year. The One Big Beautiful Bill Act added a couple of things that made the qualification for an advanced premium tax credit not harder, but it added some red tape to it. And so you have to reapply for those advanced premium tax credits every year. They don't just roll over. And so you also want to make certain that your income estimate for the year is correct so that you're not overpaying or underpaying or have a surprise come tax time, right? What is your next step? What's my next step? Well, if you're working with an advisor who works with Move Health, which is how many of you probably heard about us, contact your advisor and initiate a health planning analysis with us here at Move Health. We're going to do a full overview and an analysis of your coverage, provider networks, HSA eligibility, coverage for your medications. We're going to look at carrier stability, drug costs, and we can do the same work in the Medicare space. And so keep that in mind there's a lot of times where we work with people who are retiring at 65 and their spouse is younger. And sometimes they assume, hey, I need to work until I'm 68 to get my currently 62-year-old spouse to Medicare. It's not the case. We can handle both sides of that. And we would love to help serve you and walk you through that process. Now, that's your next step, is to be able to schedule, some time with us. Juan had a really, really good question in the chat. I have a scheduled call in November of this year with our team for 2027 coverage. Would it include a discussion on my supplemental plan for Medicare when I become eligible the next year? Now, great question, Juan. We like to separate those conversations, and feel free if there are other questions, begin to put those in the chat now. I'm happy to answer those with the last little bit of time we have. Juan, to answer your question, we would separate those conversations. That way they don't end up running together. And so we like to start the Medicare conversation about 6 months before you turn 65. And so we might touch on it and say, hey, let's get that appointment scheduled. But we're not going to cover it at the same point we're reviewing your annual session there. So Deanna, happy to help there. Very informative. Thanks for doing the session, providing explanations. Happy to do so. There was another question here from Chris, who said, if you're not eligible for subsidies, is there any other option that you have than the marketplace once Cobra or Cal Cobra expires? In California, it's one of those states where options are limited. So you could look at a healthcare sharing program. That might be something that you could review. But aside from healthcare sharing, outside of the marketplace or Cobra, California really kind of says there's not really other options that are out there. And so you're going to be Cobra, the marketplace, and potentially healthcare sharing. But that's, again, going to be a nuanced conversation there, Chris. So it's a good question. Thank you for asking it. There are some times where that is the option. Venkat, reach out to us, info@movehealth.io, to be able to spend some time with you. And yes, we can certainly help with options that are outside of the marketplace, given that they are available in your given state, location, etc. So really, really glad to be here with you all. And so, Kevin, good question. Do you charge for your services or advice? Depends how complicated your situation is. I'm joking. No, we do not charge clients, to work with us. Many times an advisor, financial advisor, they have a platform and a tool, things along those lines, they utilize to make connections to us. Advisors pay us. So if you're working with an advisor who invited you to this, you can say thank you to them because we work alongside of them and they actually make this available to you. But no, there's no cost to work with us. We are not charging a client to work with us directly. Happy to serve you, Kevin. Would be happy to work with you. So thank you all. If there are no other questions, if you have further questions, you can feel free to email us info at movehealth.io. So info at movehealth.io. Feel free to email us with any other questions that come up, and we will be sure to circulate the recording for you all of this. That'll come in the next 24 hours or so. But without further ado, I'll wrap things up. I've got to get ready for my underwater welding session. Those wetsuits take a little bit of time to get on. It starts at the top of the hour. So loved spending time with you all. Thanks for the opportunity to teach you a little bit. Hopefully you learned something new today. We'll talk soon. Have a great afternoon. Bye-bye.